Hello everyone, my name is Nina Chanana, the principal at Chanana Consulting, and I am contracted with Greenwich Together to support them with the Drug-Free Communities grant they have received from the Center for Disease Control and Prevention. Today I will be sharing the 2023 Greenwich Youth Survey data that was collected this past February from a sample of 7th to 12th graders in Greenwich. The survey was administered to youth enrolled in both private and public schools to ensure a representative sample. Greenwich Together could not collect this youth survey without the support and collaboration of our public and private schools. Thank you to Greenwich Public Schools, the Brunswick School, Greenwich Academy, and Greenwich Country Day. Data collected from this survey is used in the planning and development of strategies and practices for Greenwich Together, as well as other educational and social service organizations. Greenwich schools allow students in grades 7 to 12 to complete the surveys during instruction time at school. All surveys are administered anonymously, and parents have the option to opt their teen out of the survey if they wish to. The sole purpose of the survey is to gather information about risk and protective factors and inform how we can best support our youth as a larger community. Greenwich first began to survey students in 2018 in an effort to understand and change substance use patterns among our youth. Overall, we are really pleased with the response rate we received at around 71%. The ideal is to get as close to 80% as possible. Our 11th and 12th graders had the lowest response rates, although our final sample size was 4,041 surveys. Close to 96% of teens identified as either male or female, 1% of students identified as something else, and 3% preferred not to respond to the gender question. 69% of the youth respondents identified as white, 15% multiracial, 10% Asian, 4% Black, and 1% other. This includes Native Hawaiian and American Indian. 23% of the youth identified as Hispanic. I will be sharing the data results in two main sections, including protective factors and risk factors. Youth have both risk and protective factors, and these risk factors are bumps in the road that they will experience in their lifetime. This includes things like living in an unsafe environment or having experienced trauma. These factors can increase a person's chances of having a negative outcome. Protective factors are characteristics that can reduce the impact that adversity can have on a person. Things like having a positive relationship with a trusted adult, feeling safe in the community where you live, and feeling valued. These are some known protective factors at the individual level that we included in our survey. Here we have questions around self-image. Greenwich teens are really doing well in terms of feeling in control of their lives and future, feeling valued and appreciated by others, developing a sense of purpose in their lives, and having the ability to deal with frustration or disappointment. Another individual protective factor we asked about was connectedness to adults and youth and the community at large. Just over half the teens who took the survey reported that they are very or extremely connected to youth in their school. 1 in 4 report strong connections to adults in their school, and 1 in 3 report strong connections to their community. Another very significant protective factor for youth is having a trusted adult. and that includes 83% of our teens this year. 93% also indicated that they have a friend who supports them and looks out for their best interests. There were 113 teens, or 3% of the survey respondents, that did report not having either a trusted adult or supportive friend in their life. Do Greenwich teens know where to go for help if they, a friend, or family member are struggling with a mental health issue? 71% indicated that they do. 54% also indicated that they know where to go if they are concerned for themselves, a friend, or family member around substance misuse. There are also a lot of strengths at the family and community level. The majority of Greenwich teens report having clear rules at home around communicating with others via text or on social media, gambling, the amount of time spent playing video games, electronic or online games, and their social media use. More than 8 out of 10 Greenwich teens report feeling safe at school and feeling cared for by teachers and students at their school. 9 out of 10 Greenwich youth report feeling safe in the community. Switching gears a bit, following are some of the risk factor indicators included in the survey. These are all known factors that would increase a young person's likelihood of having a bad outcome. The consequences of social media use hold qualities that can be seen as both protective and risky. Seen here, roughly 42% of teens reported feeling better about themselves, and 33% reported feeling worse about themselves, with a subset who reported both feeling worse and better. 41% of teens also reported hearing or seeing things their parents would not approve of, and 34% reported feeling left out or excluded. Over the past 12 months since prior to February of 2023, 15% of teens reported that they had been bullied on school property, and 14% reported being bullied electronically. Females reported higher rates of being bullied when compared to males, and close to 1 in 10 teens, or 9%, reported that they bullied someone, with higher rates reported by males. Teens were given 11 categories to rank in terms of the levels of day-to-day stress they feel around each category. Among all these categories, Greenwich teens reported that academics and future expectations cause them the greatest amount of extreme day-to-day stress. This is followed by college and post-high school planning, sports achievement, and their schedules. 28% of Greenwich teens reported feeling anxious in the past 30 days prior to taking the survey, with higher rates reported by females. 15% of teens reported feeling frequently lonely in the past 30 days prior to taking the survey. On a good note, since 2021, reported rates of frequently feeling anxious or lonely have decreased. The survey also asks teens to report on other mental health indicators. 26% of high schoolers reported some irregular eating behaviors in the past year. 26% reported feeling persistently depressed in the past year, and 29% reported feeling persistently anxious in the past year. Among those youth who reported being persistently depressed, they also report lower rates of feeling safe at school and in the community, having a trusted adult, and feeling connected to other youth and adults. The majority of Greenwich teens report that their parents or guardian have clear rules discouraging them from using or misusing substances. Having family rules around use of alcohol is reported lowest at 78%. Reported rates have increased from 2021 to 2023. When looking at substance use rates among Greenwich youth, we find that rates are decreasing. In 2023, 60% of all respondents had never used alcohol, marijuana, or nicotine. We do find that alcohol use rates increase with grade level, and among all seniors in high school, more than 1 in 3 reported using alcohol in the past 30 days prior to completing the survey. Use rates among youth in 7th and 8th grade are consistently low. Youth report that they most often get alcohol from friends or from a parent with and without permission. Thank you for your time. Please reach out if you have any questions.